Great. Well, thanks very much, Grandma Karen, for those great words at the beginning of our conference. And I know you're going to stay with us for the rest of the next couple of days. And thank you very much for giving us your time. So, bonjour, bienvenue à la conférence de partenariat 2024 de Inforoute dans la belle ville d'Ottawa. So here we are again at another partnership meeting. My name is Michael Green. I'm the CEO, President of Canada Health Infoway. I've been with the organisation now 10 years. That joined in 2014, and been in the kind of healthcare sector quite a bit longer than that. And I was just kind of thinking about, what's happened over the last 10 years or so. And, I think obviously there's been a lot of progress in this sector. I think when I joined Infoway, we were still kind of finishing a lot of the kind of initial programs that the organization had. We had a lot of funding that we were still pushing through. And I think one of the issues for everybody really is the capacity of the health system to introduce kind of new technology, new ways of working, and that probably hasn't changed very much over time. But, I think our focus in those days was kind of really pushing EMRs out to family physicians. At that time, we probably only had about 50% or less of family practices had an EMR. Now it's 95%, so we're in the kind of top level of the OECD countries in that respect. And of course, now our focus is changing more into, the kind of advanced use of those systems. And I think, when we look across public health systems across the world, there's a common issue really, which is, basically resources, human resources, a lack of which, over kind of an overage of demand, a kind of tough lack of supply, and the burgeoning kind of cost envelope that health is one of the biggest, if not the biggest, expenditure that most governments or countries have. And we all know that perhaps putting more and more money into it and working in the same way, one, it's probably we don't have the exchequer to actually do that, but also that's not going to be a way forward. And although tremendous progress has been made within healthcare, when we look at other business sectors, we can see there's even quicker progress there. So there's a lot of resistance to change, perhaps pent-up resistance in the health system. It's a very highly regulated field, very kind of dispersed type of field as well. And that's one of the key challenges I think we all face as a group here of, how we can work together and address that. And I think the key thing is that we know at Infoway we're a relatively small organisation, and certainly we can make a fairly small kind of impact ourselves. I like to think of us more as a kind of catalyst, and the partnership and working relationships and convening and everything are really the areas that we focus on very much. And so this particular theme today is called Pathways to Progress, Advancing Connected Care in Canada. And, I think over the next couple of days, we're going to have some really great kind of presentations and also workshops and the opportunity to network and everything as well, and ask questions and learn new things and look at the kind of successful experiences and challenges that are going on. Over the last year, we've worked together with the jurisdictional partners, and I think we have made quite a lot of progress together in advancing data portability and interoperability standards through the implementation of a number of key initiatives like the patient summary and also e-referral, e-consult. And this work, continues to lay the foundation for seamless, secure data sharing across Canada's healthcare system. Through initiatives as well, like the Vendor Earlier Implementer Program, the Industry Collaborative, Infoway is also trying to help involve and mobilize the healthcare industry in Canada to create sustainable, interoperable digital health solutions that enhance care, improve coordination, the accessibility to care, and promoting more cross-sector collaboration across the country. And then finally, by strengthening relationships with federal, provincial, territorial governments, industry partners, healthcare leaders, Indigenous peoples and communities, and patients, families and caregivers, Infoway continues to prioritise the creation of a collaborative ecosystem dedicating to transforming healthcare and ensuring better outcomes for all Canadians. So over the next day and a half, we're going to be reflecting on the impact of our collective efforts, building a stronger future for healthcare. You know, Canada is experiencing a remarkable wave of technological growth, as I mentioned, and there's so many different possibilities that we can explore, and they've all got the potential to improve and elevate patient care, streamline operations, and drive innovation across the country. Throughout this conference, we're going to dive into some of the critical topics like interoperability, data standards, AI, innovations in sustainability, Indigenous care, and the latest initiatives from Infoway. Partnership Conference is more than just a gathering. It's a celebration of collaboration and a testament to the dedication of each person here, every one of you, who believe in the transformative power of digital health. This is a platform where we can share knowledge, we can form partnerships, and unlock the true potential of healthcare technology. So I encourage all of you to dive into the wealth of insights that we're going to be sharing and engaging in discussions and asking questions and sharing your own perspectives as well. That's what makes this conference special. It's not just what you'll take away, but it's the knowledge and inspiration you're going to share with others. And after that, I'd like to thank you all for joining us. Very much looking forward to the conference that we're starting this morning and paving the way towards a more connected, patient-focused and healthier future for healthcare in Canada. So thanks very much, and then we move on to the rest of the agenda. So thank you for this introduction.
Okay, thank you, Grandma Karen and Michael Green, for this wonderful introduction and opening remarks. Now, I would like to take a moment to thank our patient partners who helped bring this year's program to life, as well as our patient scholarship winners. And Infoway is proud to remain a patients-included conference, and we forever grateful to our patient, family, and caregivers. On this note, I would like to welcome to the stage one of this year's patient partner committee members, Anne O'Riordan, and one of our patient scholarship winners, Arun Bala. Anne is a patient experience advisor at Kingston Health Sciences Center and collaborated with many national health organizations, including as a patient surveyor with Accreditation Canada and a patient partner evaluator with the Centre for Digital Health Evaluation for Ontario. Arun is a co-chair for the East Toronto Health Partners Community Advisory Council. He has held leadership roles in several healthcare organizations. Currently, he manages the innovative Queen's Lake Ridge Health MD Family Medicine Program, a first in Canada medical education model specifically designed to address the shortage of family doctors. Ladies and gentlemen, please join me in welcoming to the stage Anne and Arun.
Good morning, everyone. My name is Anne O'Riordan, and I am a patient advisor at Kingston Health Sciences Center. I'm delighted to welcome you to this year's Partnership Conference, and especially pleased to be part of this larger group of patient partners in attendance. I am one of the 3 partners who have been working with Infoway to embed a patient lens in this gathering. Many of you met Ron Bala at the September webinar on essential digital health for the underserved, where he was one of the panelists. And tomorrow you will have the opportunity to attend Mathieu Jackson's session, Patients Paving the Way, Pathways in Virtual Health. 3 additional patient partners are here through Infoway's generous funding of patient scholarships. Robin Land from Calgary, Risa Mallory from here in Ottawa, and Arun Bala, who's a panelist in tomorrow's session, Bridging the Gap, Insights from the 2024 Digital Health Equity Analysis. And finally, our closing keynote speaker is Claire Snyman, a patient partner who will shine a light on her work as an advocate. Our photos in the slide will help you to find us over the next 2 days, and I encourage you to seek us out and speak to us. For those of you unfamiliar with the term patient partner or uncertain about our role, please let me explain. We are individuals who have experienced healthcare services and often challenges firsthand as a patient, a family member, or a caregiver. We're motivated to collaborate with you to improve the healthcare system. When we join you at the table, we may share our personal stories to provide real-life applications for your ideas and initiatives. We might confirm or challenge the relevancy of a new project. We may offer novel approaches to pilot your ideas, or raise issues that affect us and affirm the work that you are doing is a priority for us. You can find us at all levels of the healthcare system, collaborating with frontline service providers and leaders, researchers and innovators, support system experts, government and policymakers. I also share my experiences of exemplary care to acknowledge efforts that make a difference to me as a patient and a caregiver, and to thank those who support our system and our care and who are working within the system. Our patient partner communities are continuing to evolve and flourish. Our intention is to promote this growth based on principles of equity, diversity, and inclusion, so that over time, we are better able to represent our national population's unique blend of healthcare needs, experiences, and expectations. Our stories often elicit compassion and engender a desire for change, but we are more than our stories. We are willing and able partners who are eager to contribute to these improvements and innovations. We partner to offer our knowledge, insights, and wisdom. We engage with a keen awareness that we are in a privileged position of being a voice for countless others who do not have a seat at the table. We all share a stake in the improvement of our healthcare system. With connected care as the guiding theme of this gathering, our common goal is to ensure quality healthcare services with equitable access across the country. Of course, to engage in a meaningful and successful collaboration, we must have a shared understanding of our roles and expertise, as well as a common language to ensure clear communication. But perhaps the most important quality we can help to foster in one another is an open and curious mind. Many would say that we as patient partners are an underused resource in healthcare. Conferences like this create the opportunity to form new alliances and partnerships while strengthening existing ones. Let's take this opportunity to learn from one another as allies and colleagues. I encourage delegates to approach us with your questions, ideas, and hopefully invitations to work with you. And we invite you to visit us at the Patient Partner Hub, which is located just across from the registration desk, a very welcoming and relaxing space to sit and talk with us. And now please welcome my patient colleague, Arun Bala.
Thank you, Anne. Good morning, everyone. Bonjour. I am Arun Bala from Toronto. About 500,000 Swifties took over my city, so I came to spend the time with you. On behalf of all the patients, families, and caregivers, we warmly welcome you all to this year's Partnership Conference in Ottawa. I would like to highlight 3 themes how I work as a patient partner with the system. The first is the value of lived experience in driving change. East Toronto Health Partners is an Ontario Health team in just the east side of the Toronto GTA area, and we have about 350,000-400,000 population in our catchment area. It is a very diverse, mostly recent immigrants and new Canadians population base. And we have over 100 organizations providing different services, but patients find difficult to navigate through how to access these services. So the East Toronto Health Partnership worked with the patient partners and developed a digital navigation tool, and that is almost serving as a model for most of the OHTs now, how easy and user-friendly it is to get the access to the systems. The second is equity, diversity, and inclusion in patient partnership. In our community, we have a large Muslim population, and none of our hospitals or the organizations had halal food options for a long time. And last year, the Patient Advisory Council worked with the Michael Garron Hospital and worked towards a halal food option, and it has been implemented for the last 6 months now. It's one of the most successful programs. It is a work in progress. A number of other institutions also need to adopt this one, but we have been working through that system. The last one is ongoing collaboration in research. I have been working with University of Toronto's a master's program by Dr. Kerry Kalowski. The research program is patient and caregiver engagement in research programs. And about 20 students, I manage a medical school, so it always comes to me as medical student. 20 graduate students from the U of T's master's program, they partner with different patients and families. And as a research theme, they understand how can they engage, develop research methodologies, and disseminate that knowledge throughout the academia. So these are the 3 examples that I would like to share with you, how as patients and caregivers, families, that we work with the system and improve the care in our system. Thank you all for coming to this CS Partnership Conference, and let us all work together to improve our connected care. Thank you.
Okay, thank you, Anne and Arun, for this opening remarks. Now, let's take a moment to recognize the unwavering dedication and vital contributions of patients, families, caregivers to the Canadian healthcare system, both now and in the future. Canada Health Infoway pledges. We pledge to continuously listen to the perspectives and learn from the lived experiences of patients, families, and caregivers to ensure respectful collaboration in the work we do and influence. So we look forward to building true partnerships and acknowledging shared successes. Over to you, Bhavesh.
Thank you, and Arun, our patient partners, and Waldo for those great words. Over to a few housekeeping items before we really kick off, get into the program today. This year's partnership is paper-free, which means no printed programs. I'll advance the slide here.
Except for us.
Except for us. But have no fear, have no fear. I know we all love our paper, but in a connected care world, we have an app that will help us access all of the information that you need to see and understand about the program. So if you haven't already done so, on the back of your name tags, you'll find a QR code, which will allow you to scan the app, and you'll be able to download the app. You can see the programming that you have, where the sessions are, where you want to be, so you don't miss out any of them. If you do have any questions, feel free to reach out to our registration desk, which is outside in the foyer, for any help setting up the app. And then we'll be sure to be able to get you up and running. And we encourage you to use the app, as it'll allow you to follow along the sessions, find out where you want to be, and gives you a chance to connect with other attendees as well. A big thank you goes out to the eHealth Center of Excellence for sponsoring the mobile event app this year. And really, truly, a big thank you to all of our sponsors, as without them, this event could not be possible. All of the sponsors bring everyone together and allow us to collaborate in such a unique and informative environment.